But I'm hearing anecdotal evidence about clients who receive care at home refusing to allow personal care assistants and care workers to visit them. Obviously, they're scared of infection. And just on a personal basis, I had experience of this about my father, who died relatively recently, but was very ill and received personal care. I just want to understand whether you're hearing the same, and if personal care assistants and care workers who visit clients in their own home, are they getting timely access to testing, and will communicating this more widely reassure clients who receive care at home?
I think there's a huge part for testing to play in reassuring both staff and people in receipt of care, actually, that the person coming into your home has had a recent test and has had a result that says that they're negative. And there isn't widespread testing. It is growing, but the care workforce is 1.6 million in this country. So we are nowhere near the level of testing that's required.
Bristow had a brief one on workforce, and then we'll move on to the final section.
I did, Chair, and I think both Vic and Professor Green have kind of touched on this, but I just want to ask these questions, if I can, just very directly. It's obviously Mental Health Awareness Week, and so to what extent do we feel that the high death rate in care homes impacts the mental health of care home staff, and what level would you put the morale of social care staff at the moment? And then just secondly, perhaps for Professor Green, just this morning I was emailed by a constituent who told me that his granddaughter works in a care home. On a recent shift, 14 of her colleagues were off ill, and this meant that she had to deal with every situation, including administering medicine. And so this level of absence is going to have a huge impact on training. And you talked about training, earlier on. So I just want to understand, what has been the impact of this COVID-19 emergency on the training of social care staff?
Chair, would you like me to answer that first?
Please
Chair?
do, yes, please.
Well, I think your point is well made. What we've seen is high levels of absences in a system that's already been pressurised for staff. And obviously that has meant that people have had to do things that they wouldn't normally do. And interestingly, a point made earlier, I think by Vic Rayner, was that when the NHS had withdrawn many of its services for care homes, suddenly things that care home staff were told for years they couldn't do, they were then being asked to do. So what we had were people really stepping up. In terms of where we need to go with this, though, we need to have some mechanism to identify where there are staff shortages, and then some mechanism to try and find ways in which we can plug that gap, but recognising the challenges of doing that because of people coming from outside and the risks of COVID. Interestingly, the point about where morale is, I think it's really important to recognise the enormous pressure on care home staff, and they go through tremendous challenges around people who they really like and have known for a long time dying. And that was, as Vic Rayner said, it's being really accelerated in this pandemic. But one of the things that I have noticed is how good staff are at self-support. I don't think we should leave it to self-support, and I think we've got to get some mechanisms for mental health services to go into care homes. There are some care homes, particularly the larger groups, have identified how they do that, and they're offering support to their staff. But it is a massive task when you see the numbers of people who are in the social care workforce and the numbers of people who are going through, first of all, the huge pressure of doing a range of things, the pressure of not having the support they would normally have because there aren't as many staff around, and also going through what might be described as a constant cycle of bereavement.
Could I just quickly add something, just in relation to, I think it's such an important point, and obviously it is Mental Health Awareness Week, and we have got to get that support right. I know in hospitals there's been a very important focus around supporting people in terms of loss and bereavement, but also in the context of trauma. And I think this is what a lot of people who are working in care homes will be going through and will need additional support around that. I just wanted to also mention about in relation to staff shortages, there have clearly been a number of calls that have been related to the NHS, primarily around nurse returners, for example, and indeed the 750,000 people who volunteered their time to the NHS. We have been asking for many months now for some of those resources to come into social care, and I think the fact that we haven't, as far as I'm aware, if we've had any, we've had a very, very small number of those nurse returners come into the social care environment to date is really problematic, because that kind of expert additional resource at this time of need would provide support for those staff, provide some additional resource and clinical skills that are desperately needed, and indeed that range of volunteers could be very usefully utilised, and we provided lots of examples of how that could happen in order to provide not necessarily direct personal care, but some of the other ancillary services that go into the running of both care homes and supported living settings. So I think we have had some additional possibilities of bringing in some supportive resources, and we haven't grasped them yet, and we must do that going forward.